Gallstones, unfortunately, have become more commonly found as people have lots of scans. In my opinion, you only need to have them removed if they are causing some trouble. The trouble that you can get may be some pain. You can also sometimes get them infected, so you have fever, shakes or sweats. Or the gallstones fall out of the gallbladder and into the liver ducts, in which case you can become jaundice, where your eyes turn yellow and your skin turns yellow, or you develop a condition we call pancreatitis. I think these are all what we call absolute indications to have your gallstones removed. If you just have a little bit of pain, or if you've just been found to have stones, by the by, then the best thing to do is probably talk to your GP or get referred to a surgeon to talk to them on an individual basis about whether you really need to have them removed and what it all involves. The surgery to remove the gallbladder involves a general anesthetic where you go to sleep fully, and also keyhole, or what we call laparoscopic surgery. Sometimes if you're healthy and it's done earlier in the day, we could often do it as day case surgery, where you have your operation and then you can go home the same day later on in the evening. The keyhole surgery involves 4 cuts usually, 1 at the belly button and 3 more up near the rib cage. The one at the belly button is usually the longest one, but measures usually no more than about ½ an inch. The 3 little ones at the rib cage are almost like little stab wounds. Through that, we put a camera in, we use long instruments, and we take your gallbladder out and free it off the liver. We put little clips on all the attachments, and then we put it into a bag and pull it out of your belly button. The cuts that you see are usually very nice, and if all's well, either go home the same day or more commonly go home the next day. Discharge from the hospital, usually the same day or the next day. Sometimes it is quite a difficult operation, or there's been any problems, then it may be just an extra few days. Most people are advised to take off work for 2 weeks, but during those 2 weeks you will be able to walk around normally at home and just slowly get back to your sort of normal strength. If you do a manual work, like quite physical lifting or a lot of moving about, then I sometimes advise being off work for up to 4 weeks, because you do spend, your body is trying to spend all its energy recovering, and you can get tired quite quickly during the day if you're quite physical. But I would expect that by about 4 weeks that most people are back up to their full strength if there's been no complications. Most people after the operation don't feel any different, apart from the fact that they lose the pain that was associated with the gallstones. Occasionally people complain of diarrhea, and that can be due to the bile acids coming into the intestines a bit quicker. And this is usually self-limiting. So if you do get diarrhea with loose stools, it usually disappears within about 4 to 6 weeks. In terms of complications, there are some minor things which are more common. Every time we do an operation, we always warn about the risk of wound infection and bleeding or bruising around the wound. These are quite easy to treat. Wound infections usually treated with antibiotics. Bruising, we usually just watch and they go away within 2 weeks. The more serious risk is something like bile leak, where there's a leakage of bile from where we've tied off the structures that connect the gallbladder to the liver, or where the raw surface that's left from the gallbladder being removed can leak a bit of bile. This is very rare, and if it does occur, then it is quite easily treated, but it sometimes may involve another operation. We do it through keyhole, we wash it out and put an extra stitch in, and it solves the problem.